From the News Channel 5 network, this is Urban Outlook.
And welcome to Urban Outlook. I'm April Eaton. Thank you so much for being with us today. A new congressional report is out, and this year it highlights the health disparities of people with lupus. Did you know that 90% of people affected by lupus are women? And African Americans are 3 to 4 times more likely to develop lupus. The report, which is called the 2015 Kelly Report on Health Disparities in America, was recently released by the Congressional Black Caucus. There's a big think tank that they have there called the Health Brain Trust, and they've been doing some research and finding out some facts about lupus and the impacts of the lupus on people. Today, we thought we'd take a look at lupus and what the report is saying with a couple of experts in the field, I'll say. Dr. April Bonardeau, thank you, from Vanderbilt University in the Rheumatology Department, and also Rakara Lee, who is a longtime lupus patient and has been working and living with lupus. So thank you both for being here today. As I said, the Congressional Black Caucus just released this report. One of the findings, of course, is about the disparities that exist. They said in the report, lupus is a dramatic and significant public health problem among racial and ethnic minority groups. I know you know this well, Doctor. And it also had a quote from U.S. Representative Robin Kelly, who's a Democrat out of Illinois. She said, "Now is the time to address this disease, which disproportionately impacts young African American women, and that as many as 1 in 250 black women will get the disease." So that sounds pretty serious. So let's start with some of the basics and talk about what is lupus.
Sure. So lupus is a chronic autoimmune disease, and when I say autoimmune, I'm referring kind of to the immune system. Normally our immune system should fight infection, bacteria, and viruses. However, in lupus, the immune system's revved up where it attacks itself, so normal healthy cells are attacked. Lupus can virtually affect every organ in the body. Some of the most common symptoms are fatigue that can be quite severe, skin rashes, joint pain, but also can affect major organ systems in the body, the kidneys, the heart, the lungs, the brain. And as you've already mentioned, lupus is much more common in women compared to men. We estimate there's probably about 1.5 million people with lupus in the United States. We also know that women of African American and Hispanics are more likely to be affected than Caucasians. And we also know that women of kind of childbearing age, so younger women, are more likely to be affected. But lupus can also affect children, adolescents, and the elderly, and can affect men as well, but again, women being more common.
And why is that? What is it about the makeup of us that makes us sort of prone to lupus?
So we don't know the exact mechanism of why women have it more commonly, but we think it's probably an interaction of our genes, the risk we inherit from our parents, maybe some environmental triggers. For women, we wonder, like sex hormones such as estrogen maybe that play a role, because we do know that pregnancy can make lupus worse. So again, we think that hormones may play a role, but that's an active area of research currently.
Rakara, you've been living with lupus, as I said. Will you tell us a little bit about your story, how you discovered you had lupus and when, and what that's all about?
Sure. I have been diagnosed for 9 years now. Kind of found out by having a series of illnesses, and that led me into the hospital. At the time, didn't know what was really going on. They tested me for several different viral type of infections, and my ANA was positive. Still didn't necessarily know it was lupus, but then they went and did some more tests, and at the time didn't really notice that I had the butterfly rash that was growing that is so common seen in people that have lupus. One of the nurses actually diagnosed me, well, not diagnosed me, but she thought, hey, maybe it's time for you to see a rheumatologist. And when the rheumatologist came in, he knew exactly that, oh, okay, this is lupus. Since I've been diagnosed and on the right type of medication, I'm pretty healthy. I mean, I live a healthy life with lupus.
Very good. So is lupus something that you were familiar with before the nurse noticed as you said, the butterfly rash, or is it something that you know from your family experiences, or just was a surprise to you?
Well, I had a cousin that had it by marriage.
Gotcha.
And also, I did have some experience because I have been in healthcare, so I did know what it was. But not knowing all the different signs and symptoms and how it really affects the body, that's the most important part.
So let's talk about that. What are some of those signs and symptoms that if people are feeling ill, like you were, but they don't know what's going on, what should they look for?
Sure. It can be difficult to diagnose because lupus can affect every patient very differently. Some patients may just start out with fatigue, which can be a difficult symptom to tease apart. It can be related to infection, mental health problems, other health problems, so it's hard to make a diagnosis of lupus just from that one symptom of fatigue. But other more kind of specific symptoms we look for are skin rashes like the butterfly rash that can be redness over the cheeks and nose. There can also be other kind of scarring type rashes in the scalp and the ears, hair loss associated with that. There can be joint pain and joint swelling, stiffness. There can also be problems with the heart and lungs where you have shortness of breath or chest pain and have fluid around the heart or in the lungs. We also worry about the kidneys being affected with lupus, which can manifest as having an elevated blood pressure or having swelling in the legs, for example. But again, it can be a difficult disease to diagnose because, again, everybody can present so differently, and it can affect every organ system.
One of the things that the report said, Dr. Bonado, is that there needs to be more focus on lupus, that maybe it's one of those diseases that has gotten sort of lost in the shuffle with all the focus on other health issues that women have, particularly African American women. So what needs to be done? Is there, I know you're an expert in the field, but there are probably not enough of you going around and probably not enough money going to research lupus. So talk a little bit about those issues and challenges.
Sure. So I definitely would like to see just more awareness of lupus and education in the medical school curriculum. It's a lot of medical students haven't been exposed to lupus, haven't seen it clinically, and even in residency. So having just more medical education and getting medical students interested in rheumatology, and I think would be helpful. And again, more money for research and looking at what causes lupus, what triggers lupus, and looking at why certain patient populations, particularly African Americans, don't do as well with lupus compared to Caucasians.
And I'm sure you've, through the years, learned a lot about lupus as well. So talk about the importance of making sure we have those dollars behind the research to help provide the care and the treatment, the things that you're getting now that make you feel a whole lot better than you probably did about 9 years ago.
Right, and just like piggybacking what you were saying about the healthcare providers, like I said, it was a nurse that kind of saw the signs and symptoms and was able to present that to the doctor. That's so important to make sure like our primary care physicians know and see it, because so many times when you go to different physicians, they may not be aware of all the signs and symptoms and not be able, because a lot of times you may present and you look like a puzzle, and they have to be able to put the pieces of the puzzle together. And just having more healthcare providers that are able to understand this disease and how it affects different people.
So is the goal to find a cure, or is the goal to just make sure we have the right treatment to maintain? Talk a little bit about the difference there.
Sure. So I'm sure the long-term goal
is always to find a cure.
Always to find a cure.
Didn't know how difficult it was, so that's why I positioned it that way.
It is quite difficult. The immune system is very complicated. There are very different kind of moving parts, and so we have to kind of understand how those parts interact to cause lupus. So probably more of the research is going toward trying to find treatments for the disease, treatments that will help kind of quiet down the immune system, but are still safe in that they don't promote infection in our patients with lupus, which can be a complication from a lot of the treatments that we prescribe for the disease.
In your findings here, how widespread is lupus? I mean, how many people, I guess, and it might be a difficult stat to know, but for the most part, how many people are finding themselves affected by lupus these days?
Well, again, estimates are about 1.5 million people in the United States, but lupus can go undiagnosed for years. So there's probably a lot more people out there that have lupus, so that may be an underestimate.
Is there certain parts of the country that are more prone than others, are you finding?
So we're seeing more lupus predominantly in the southeast, maybe because of more African Americans living in that area, also in urban areas of the country, but there tends to be more lupus in the southeast.
If you got, you know, Rikara, if you have sort of a goal in mind about what you'd like to see from a patient perspective, talk a little bit about what that looks like for you.
That would look like a pain-free, kind of disease-free day. You know, each day I go, you never know what each day is going to look like because you never know what type of pain you're going to be in. So having that type of day, I'm sure for most lupus patients, they would agree that that would be the ultimate goal. And even pain-free, where you don't have to spend time taking pain medicine and going through all the different side effects of that, would be a good day. When a day when you can put your feet on the ground and know that it doesn't hurt for you to stand up, that's a good day. So I think that's ultimately the ultimate goal, is just to stop the progression of this disease and make people more aware of it so that they can get on the right treatment and find the right things that are going to work for them so that they're able to live with this disease.
It's interesting that it impacts such young women, and one of the things that I think I found in that study is even young women of childbearing age. So we're talking about very young women who are finding themselves with lupus, and then they have to live a long time with that. What is it about young women in particular that's happening to our immune systems, do you think? Well, I'm not so young anymore, but that's happening to the immune system that makes this sort of a disease that's prone to them?
Again, we're not exactly sure, but we again think that kind of sex hormones like estrogen may be playing a role, because we know that as women kind of get older, rates of lupus tend to drop off, like in menopause. So we think it may be kind of hormonal factors that are interacting with the immune system, our genetics, other environmental factors.
Gotcha. Well, let's take a quick break. When we come back, I want to have some more, particularly some things that are going on right here in Middle Tennessee to make sure that we shine a light on lupus. We'll be right back. Just stay with us.